Hello friends, Sarah here from the Centre for Mental Health. I hope all is well this week. Today I'm going to talk about children and young people's mental health, very much inspired by the BBC One Panorama documentary on Monday. Before I do go into talking about mental health specifically, I want to acknowledge the power of the stories that were told during the film. So thank you to Rubin, Jess, Keris and Bex for sharing their stories, because absolutely at the heart of all of these conversations about children and young people's mental health are children and young people. And for many, they're not getting the services that they should be right now. And I think that the young people that we heard from in the film conveyed some deeply disturbing messages, but ones that we needed to hear. So I really thank them for doing that, but also wish them well on their recovery journey. I don't like using words like epidemic or crisis, because I do think that they can frighten people and often create kind of polar conversations about what's really going on. However, without a doubt, children and young people are expressing signs of distress in more ways than they have done over the years right now, and that we are seeing more children and young people seeking help from services. And I think that what we have to recognise is that the system across NHS, community services and schools are currently not fit for purpose in terms of what children are expressing. So whilst I kind of don't want to say, you know, we need to be worried about all of our children, I do think we need to be creating communities that can start really thinking about building the resilience and well-being of our children. But when children become unwell and seek help, they must have the services that can intervene at the earliest opportunity and give them the best chance for recovery. At the moment, we do know that it takes a number of years for most children to get a diagnosis that can help get them to the right treatment. We know that people are travelling long ways from home. The stories in the film clearly demonstrated the fact that there is a bit of a postcode lottery in terms of what people can access. We know that there are problems in terms of thresholds. How poorly do you need to be before you get help? I think is the question that I'm interested in knowing too. I think it's incredibly important to think about all of the public health things that we can do to help our children develop mentally well kind of lifestyles and practices, of course. But I do encourage public services to really rethink the way they're delivering the map across the country. So we look at inpatient beds, and there is an argument that there is not enough of those. But actually, children might do better if they were treated closer to home, at home, with services in the community. So we welcome certainly the NHS commitment for 1.3 billion extra investment into children and young people services, and we're keen to see the transformation promised by 2020, and we will keep arguing for the ring fencing of those funds. And of course, it's probably not enough. We know that children need to be kind of treated in a holistic way. So again, thinking about you know, what is their lifestyle like? What is their home life like? Do they have secure accommodation? Are they from low to middle income families? And is there some kind of problem around that? There are so many factors. We've talked about those before. We have put together a kind of really helpful fact sheet that you can download from our website about children and young people's mental health, and I urge you to do that. Be kind of, you know, have the facts at hand. Really know where you might be able to access help in your area, and Young Minds has a parent helpline that's really helpful. We also welcome the government's commitment to helping teachers and schools develop specialist teams that can provide help. You know, children are at school for a lot of the time, and whilst we're not asking teachers to become therapists, we do accept that absolutely teachers are part of the answer. Emotionally intelligent engagement and environments at school would without a doubt have an impact on children and young people's well-being, and we're seeing significant progress around the country, schools delivering well-being classes and so on and so forth. We worked in partnership with the Royal Foundation, Young Minds and others to develop a website portal called Mentally Healthy Schools for teachers and parents to look at ways in which they might engage children, particularly of infant age, certainly in primary school age, how they might address worries, how they can think about their well-being. The site offers a huge amount of well-evidenced and tested ideas about how we might be able to intervene. We're right to be worried. Children and young people's mental health, we're at a tipping point of sorts. We need to know more, we need to understand more, we need to listen to our young people. I want everybody, no matter where you are, parent, aunt, cousin, to think about the well-being of the young people around you. The answers aren't easy. We know that services have some way to go. In the meantime, what can we do? We can start developing conversations with our children. We can help them understand how to manage their own emotional well-being, but we also need to be able to give them the tools to ask for help when they need it. I certainly, as a parent, want to think about how I can address some of those issues. But I also know if my child needs help, I hope that the services would be there to deliver what they needed. We're not quite there yet. We do want to know from our followers and friends your experiences of children and young people's services. We certainly want to convey those messages to all the people that we work alongside. We're developing the long-term plan for NHS services now with partners, and of course we want to know what you want to see. Do look for information about children and young people's mental health and get in touch. See you next time.